Hi, everybody. Welcome. We are going to be talking about some spicy stuff today. So, today we are going to talk about desire. And over the years, there have been a lot of misconceptions about how people experience desire because, there has been some attempts on the part of pharmacology to figure out if we could get a desire pill, if eating a certain kind of food would help us, feel more desire. There are all kinds of attempts that have been made to really understand sexual desire. But the most reliable path to sexual desire, increasing sexual desire, maintaining sexual desire, creating sexual desire is in our brain. Our brain is the biggest sex organ. So if we can generate a lot of desire by thinking a certain way, by conjuring up, erotic images, by reading erotic books. So our brain is the biggest manufacturer of desire. So I want to first say that. So we are in charge, really. So there are a couple of things that can interfere with the creation of desire in our brain. So please listen carefully, especially for cancer survivors. Pain can be can be a part of readjusting to sex after cancer treatment because of the factors I mentioned before, where your body is without enough estrogen. So your vaginal walls become very thin and can easily bruise. And so it can cause pain during penetration. If you are in a heterosexual relationship and if you're having penetrative sex, then that could become a problem. So if you're experiencing any sort of pain during sexual interaction, that is going to then interfere with desire because your mind is going to remember the pain. And you're going to go, I'm never going there because what's the point? It hurts. So it's if you're experiencing pain, I would suggest stop penetrative sex because you're not ready. You need to do a few other things before you could go there. So try other ways to be sexual and do not do anything that causes pain because pain suppresses desire. So that's very important for everybody to remember. Pain. So don't grin and bear it. Don't force yourself to do something just to please your partner because you're going to pay for it later. Your desire will go down. And another thing that affects desire is, stress, being preoccupied with something, feeling uncomfortable in your space where you're being sexual, being distracted with chaos inside. You have your tax documents lying there, you have your children's toys there. All of those can interfere with desire because desire is very finicky. So you really have to kind of protect your mental space if you want to feel desire. So, what are some of the ways in which we can create desire in our minds? So, I've told you about all the things that interfere with desire. So, what are some of the things that can create desire? Definitely, eating well. I'm talking about partners, people with partners and without partners, because desire is something we feel. So even if you're single, you can feel desire and you can use desire. I am a big believer, as I told you in the last class, about solo sex. So anybody can have solo sex. So I'm not just talking about partnered sex. I want all of you to remember that. And if you can become champions in solo sex, you can become champions in partnered sex too. Because being sexual with yourself, understanding your body, knowing your what pleases you, what doesn't please you, how to really bring yourself to orgasm is a very important step towards becoming sexual after you've had treatment. So if I say that, then fantasizing and self-pleasuring are two very important steps to creating and maintaining desire. So what can we fantasize about? Sometimes people tell me I don't fantasize about anything, but if you have an active mind and if you read, I don't know, can anybody tell me what are some of the things that um get you turned on? What are some of the, movies or books or novels or what turns you on? What interests you? I know that Bridgerton was a super hit, could it be something like that? Could you somebody just wrote Bridgerton. Yes, you were thinking what I was thinking. And there are novels. I remember reading a lot of romance novels when I was a young person, and then um, uh, there are so many opportunities now because the romance novel world has expanded exponentially. So you have a lot of novels that are available. So in my resource list that I just sent to Rachel, there is a lot of like little, novels that are erotic. So you can pick and choose what you want. So, what turns one person on doesn't need to turn everybody else on. So if you find that one book exciting, it doesn't mean everybody else is going to find the same book exciting. We all have our very unique themes that excite us. Okay. So there was a writer called Jack Morin. He talked about our own, kind of, we all have our erotic themes, core erotic themes. So it could be a core erotic theme could be, related to flirting with someone in power. It could be, kind of being drawn to a previous partner, so you can fantasize about a lot of things and it is just in your mind, so you don't have to, tell your partner, I want to apologize to you, I'm fantasizing about um the night in Bridgerton. I mean, it's not a big deal. It's your mind, and you can fantasize about anybody and anything you want. So some of these resources that I have given you in the resource list can be used. For instance, there is an app called Dipsy. It has a lot of scenarios, like 8-minute scenarios, sexual scenarios that can be very exciting. And some of the people I work with really enjoy it. And then there are other books and resources I have added that could be quite exciting to read. So turning yourself on is a very, very important step to creating desire. So if you could try this for my sake, and then you let me know if it works or not, doesn't work. I've already put my email on that resource list, so you can always email me and tell me it didn't work. That's okay. So, fantasizing, getting something that would excite you or interest you, and then, finding a quiet time to pleasure yourself. If you have like an hour when you're not working, or it's a weekend, your partner is out food shopping, or you're a single person and you have time, then try and use a vibrator if you need to. If you could use if using a hand works for you, try to pleasure yourself and bring yourself to orgasm. So you need to really figure out your own erogenous zones. What turns you on? What kind of touch works for you? What helps you come to an orgasm? Then you can then share it with your partner later. So the first step would be to pleasure yourself. So desire comes from practicing this within yourself. So, you have to really kind of work on, um, kind of uh, pleasuring yourself, and that's what is going to increase your desire. So, does anybody have any questions about what I've said so far? Let's see. For those without partners, how do we create desire? Same. I've already told you that the advice that I'm giving you is not just for partnered people. This is for everybody because we all have the ability to bring ourselves to orgasm. That's what is really nice about being a human being, that we have the ability to self pleasure and bring us to orgasm. Uh, okay. So far, no questions, but please feel free to put any thoughts and questions you have in the chat because I'll be glad to talk to you about it. So, with your partner, it is very important to talk to your partner about what pleases you. Because if your partner is doing something that, oh, feel free to send, okay, directly, oh, my soaring, okay, great, okay. Yes, good question about meds interfering with desire. Yes, meds will interfere with desire. And that is a known fact. There are certain medications that interfere with desire. So the way to create desire is, if the medication, if there's a way to offset the sexual desire component, like for instance, when people are taking antidepressants, it can really suppress desire. But sometimes they may add another drug that will offset the sexual side effects. If that's possible, by all means, speak to your healthcare provider about it. Speaking to your healthcare provider is a very important step. You could say, I'm not feeling any desire. Is there anything that can be done to offset the side effect of this medication that I'm taking? If they can do it, great. If they cannot do it, then follow what I'm telling you to do. Keep using your mind to find a way to pleasure yourself because that's how your desire keeps growing. So, and you know what? If you don't feel desire because you're going through chemo actively, that's okay. Take a break from sex and it's okay. You can take a break from sex and you don't have to worry about that. Desire doesn't, it's not a constant. It's like appetite. It comes and goes. So I don't think, anybody in the world has desire that is constant in their body. And especially for women, because women have the desire hormone is testosterone, and we have less testosterone in our bodies than our counterparts. So women have, more of a tendency to experience severe fluctuations in desire, and that is okay. So I would suggest you can normalize some disturbance in desire when you're going through treatment actively and say, I'm taking a break just temporarily for a couple of weeks, and I'm going to see what happens later. And when you're ready to start experiencing pleasure, then try your fantasy, try your masturbation, try your bubble bath, pleasure your body, and see what happens. Okay? I understand that. You see, one person says one factor interfering with my desire is how cancer and estrogen blocking drugs have suddenly aged me overnight. I suddenly feel old and undesirable, very vulnerable. My partner is so kind about it, but I'm struggling with this new self-image. I'm so sorry you're experiencing that. It is not uncommon that when you lose your estrogen because of the estrogen blocking drugs, your body image does change. This is about body image and how you feel about yourself. And sometimes our body image is tied to what is called the sexual self schema. That is how we feel about ourselves as sexual people. That is when, this is how I feel about myself as a sexual being. And so when your body suddenly changes, it trips you up a little bit and you feel like I'm never going to experience desire again because my body has changed. I feel old. I feel undesirable. This will be the rest of my life. That is the state of mind I want you to change. Because think about cancer as a transient thing. Yes, it's a huge milestone and it does a lot of things to your body, but you are going to get better. Things will change and you will be able to be sexual again. Your body will change to a point that you will appreciate it. But any change, sudden change to our body does is very scary. It's a scary thing to look at ourselves in the mirror and think, I can't believe this is me. I've changed so much. Will I ever be sexual? I'm going to ask you to have faith in the fact that you will regain your sexual desire eventually. It is going to take some time. It's not going to happen right away. But please listen to what I'm saying about, doing good things for your body, and you will experience desire again. And one person said, still under maintenance chemotherapy treatment, honestly, I can't feel any desire. I'm very tired and lack of energy. Yes, this is the time in your treatment you should be resting and taking care of yourself. And maybe this is not a good time for you to feel desire, but please keep in mind this too will pass and you will feel desire, even if you have to, even if you go through maintenance chemotherapy, you will have breaks. And during those breaks, your body will kind of recharge. We are very resilient human beings, and there's a time when you will feel desire again. Yes, induced menopause side effects. One of the induced menopause side effects is loss of desire and loss of arousal. So you're going to have vaginal dryness. You're going to experience reduction in testosterone and in desire. But you definitely can, even though a lot of things are scheming against our bodies during treatment, our mind is still alive and active because nobody can touch the brain and its capacity for imagination and fantasy. So that's how you're going to bring desire in. So, how long after maintenance treatment can does desire come back? I can't tell what would work for you because, I have also been through chemotherapy. I've also been through treatment. So I can't tell. And I knew a lot of people who are going through treatment at the same time. Things happen differently for different people. Some people have more desire naturally, so they can bounce back easily. And some others, are optimistic about what is going to happen and will try all the measures that I'm suggesting. And so they may bounce back faster. So in my opinion, stay positive. I know it is not always, possible to be positive when our bodies are changing and we're feeling terrible. But try the resources that I'm giving you and see what happens. But there's no, like, okay, after 3 months, after 2 months after the treatment, you're going to feel better. But your body will recalibrate. So, and will, be ready to be sexual, and you will know it when you're not feeling too tired and when you feel your body is changed for the better. Any other questions?
We did get one question, private message that I can share with you directly if you want to just look in
Sure,
your,
sure. Yes,
yeah.
please. My nipples are most sensual and erotic part of my body and did so much towards helping my arousal, and now they're gone and no feeling. I am so sorry about that. Yes, it's definitely so we all have had losses. It's the nipples, it's the ovaries, it's sensation of the skin. So all of us have experienced these losses that can feel tremendous, and it may feel like this is not, this means that end of our sexual life. It is not so, because you can sexualize your new body. Yes, you have to mourn the old body. Like, yes, we don't have the breasts we had when we were young people, when we were turned on by nipple stimulation and we were turned on by erotic touch specific to the breast. But you have new breasts, you may have to welcome it, and you may have to really try to arouse it in different ways and see if you can experience pleasure. If breast, our whole body is erogenous, so our nipples may be the most erogenous parts of our body, but our body is sexual throughout. So maybe find other parts of the body that can get turned on, you know so explore, touch different parts of your body. And if you have a partner, ask your partner to touch your neck, maybe your scalp, maybe the small of your back, the area behind your neck, and see if all of those parts can be aroused, because our body, all the sexual feelings are not concentrated in one part of our body. Our body is can be sexual throughout. A whole body can be aroused. So we have to try, take the challenge to try other parts of the body that are sexual. But that's a very good question. You're all asking very good questions, and I relate to all of it. I hear and I understand all of it, but you cannot give up on sex because of the changes that you've gone through, because you will be able to be sexual if you could work on some of these things. Any other questions you have? It is a good idea to sort of, um, you have to mourn the parts that are not sexual anymore and let it go. Write a letter to your breast. Some of my clients find it beneficial to write a letter to parts of their body that they no longer feel sexual feelings in, and then they let it go, and then perhaps you can then um, you know sexualize other parts of your body. Suggestion for vaginal dryness, we talked about it last in the last class. So vaginal dryness, you have to use moisturizer, vaginal moisturizers, and lubricant. So vaginal moisturizer is more like a maintenance thing. Like when you shower, take a shower, you come out of the shower, you use a cream on your body. And the vaginal moisturizer is something like that. It's for moisturizing your vaginal walls. You use that. And then when you are being sexual, you can use a lubricant. So the moisturizers to kind of maintain the moisture in the vagina, and the lubricant is more for like preventing friction during penetrative sex, or even if you use a dilator. We talked about the dilator, right? We even showed a picture of the dilator in the chat. So when you're using a dilator, you may have to use a lube. Okay. So how long? Okay, suggestions for vaginal. Okay, thanks for the positive. I really appreciate that. I'm trying to be. I'm giving you positive message because that is what worked for me. How can we communicate all these feelings to my partner? Can he participate in the class? You know what? I would love to do one class if everybody is willing to do that with a partner. So Rachel, you can talk to Sue. Perhaps I can talk to Sue and I can email her, and I can just do one class um, for survivors, thrivers, and their partners. I'm glad to do that. I do couples work all the time, so I'm glad to do that. Candidates, I'm not going to be able to answer a question about candidiasis because that is something that your gynecologist should be able to answer because I'm not a medical doctor, so I don't feel qualified to answer that question. And I hope you can ask your healthcare provider about it, um, because they should be able to manage that. Because I don't want to give the wrong answer because I'm not really, that's not really a qualification of mine. And then was there a list of products, moisturizers, lube from last week's session that was sent out? I didn't seem to get it unless I missed it. So this is what I'm going to say to you. I would say, on the resource list, there is a sexualityresources.com website, and they have an entire section on cancer recovery, and they have lots of lubes, moisturizers, and it's run by a sex educator and a physician. So you can call them, you can get samples, and you can try all of them. Never had chemo, however, breast surgery did interfere with arousal. Yes, it did come back. Yes, it can come back because it's not going to feel the same way like it felt before. It is going to be different. But as I told you, our bodies are so resilient. I when I was in training as a sex therapist, we had a guest speaker in my class. He had spinal cord injury, and he came to speak in my class. And he said, with creative experiments, he was able to figure out how to have an orgasm. This person had a severe spinal cord injury, but was able to have orgasm. So, so I think we are all very resilient human beings. We will just have to find what works for us and not get demoralized because one part of a body is not working the way it should be working because we have so many other parts. Our skin is one of the brain is the biggest sex organ. The skin is the it has huge surface areas, and all of those areas are erogenous zones. So we will have to figure out what works. So the resource, this is a more updated version. I'm gonna, email, and then Rachel, you can just email it to Sue, and you can put it on the website. And so don't forget that the drawer, is a store owned by a sex therapist, and she gives, because she was my former student, she gives all my referrals 20%. You just have to put Sabita 20, and she'll give you a 20% discount. So that's something. Lots of emotions and grief in this topic. I understand that. I think with such compassion and empathy, I feel heard and understood. Oddly, that just made the tears start to flow. I know exactly what you're talking about. There is a lot of grief. I'm not going to say it is not there, because as someone who really enjoyed nursing, for me, that was a very huge sadness when I had to have my double mastectomy. It was really hard. So I hear all of you. It is a lot of emotions that we need to really work on. We need to really feel it, but understand that this too will pass, that you will get to the other side and you will be okay. I can promise you that. Okay? So the website is, I think it's called The Drawer. Drawer is a sex shop owned by a sex therapist. I just gave you several sex shops so you can, and these are all reputed, it's run by a sex educator, sex therapist. Coupon code is Sabitha 20. So the other sex shop that I talked to you about is this one, the sexualityresources.com website. They have an entire section for cancer survivors. And that is very good. And they will also send you little samples of some of the um, products that they are talking about. So you can see on the show Firefly Lane, they have a going away party for the one character's breast. Yes. I actually did a breast party for a friend of mine who was having a mastectomy because she wanted to do that. And it was really a kind of we all had very mixed emotions because, there was a lot of sadness, but there was also, a lot of, liberation. She said later that she felt liberated because she will no longer have the cancer and it'll be gone. And the party kind of helped her. So yes, so any ritual that you can do to grieve would be very helpful. If you want to write a letter to the breast. I mean, one of the persons I was working with wrote a letter and she said to the old breast, she said, I remember all the fun we had. I remember being touched for the first time. You gave me a lot of pleasure. You allowed me to nurse my children. You gave me pleasure for years. Now, unfortunately, you have a disease. I have to let you go. I'm so sorry. I'm going to let you go now. And thank you for everything you did for me. And then letting it go and then welcoming the new breast, which is not perfect. It's not what you want. It's scarred. It may have radiation burns. It may not be perfect, but you're here. You're going to be with me for the rest of my life. And I'm going to welcome you and I'm going to treat you well because you're mine now. I'm going to treat you well. So that's sort of some sort of a, ritual like that would be really helpful because loss is really difficult, and when you kind of deal with loss with respect and with some sort of a ritualistic processing, it would be really helpful. So we are almost at the end of the session, so if you have anything else to ask me, please ask me now and I will be here again next week. Okay. Thank you for being patient with me yesterday, and thank you for being here.